All right, welcome to our explainer. Today, we are talking about something that, man, so many of us deal with, allergic rhinitis. It's way more than just a case of the sniffles, right? And really understanding it, that's the key to finally feeling better. So let's get into it.
You know that feeling, right? The constant runny nose, the sneezing. You're thinking, is this a cold that just will not go away? But what if it isn't a virus at all? It's super frustrating trying to figure out what's actually happening. So what is allergic rhinitis, really? Well, at its core, it's your body's immune system getting kind of mixed up. It sees totally harmless stuff, like pollen from trees or dander from your cat, and thinks they're dangerous invaders. Seriously, think of it like a faulty security system that's calling in the big guns for a leaf blowing past the window. It's a massive overreaction.
Okay, so before you can even think about relief, you've got to know what you're up against. So let's jump into Section 1, getting the right diagnosis.
So, how can you even tell the difference? I mean, they feel so similar sometimes. But there are a few dead giveaways. The first one, itching. If your nose, your eyes, or the roof of your mouth are itchy, that's a huge flag for allergies. A fever, on the other hand, that almost always points to a cold. But honestly, the biggest clue is the clock. A cold is usually over and done with in about a week, maybe 10 days. Allergies? Oh, they can hang around for an entire season. It's a big difference.
Getting an official diagnosis isn't some big, scary mystery. It's actually a pretty clear three-step process. First, it starts with your story. You're just going to tell your doctor everything, what your symptoms are, when they pop up, what seems to make them worse. Next up is a quick physical exam, where they'll look for signs like swollen nasal passages. And finally, if needed, allergy testing to nail down the exact culprits.
Now, when it comes to the actual testing, you've got a couple of options. There are blood tests, sure. But, most of the time, doctors prefer skin testing. And there's a really simple reason for that. It's just more sensitive. You get faster, more specific results, which helps pinpoint exactly what's setting off your allergies.
All right, so you've got the diagnosis. Now it's time to actually do something about it. In Section 2, we're opening up the entire treatment toolkit. We're going to cover everything from simple home strategies to the most effective meds out there. Let's see what we've got.
The best treatment is sometimes avoiding the trigger in the first place. And this doesn't always mean you have to make huge, drastic changes to your life. Simple things, like using your AC to keep the windows shut during pollen season, or grabbing some of those special mite-proof covers for your pillows and mattress, those can make a massive difference. Seriously, they can cut down your need for medication big time.
Okay, let's talk antihistamines. This is what most of us reach for, right? But it is so important to know that there are two different kinds. You've got the first-generation ones, like diphenhydramine, the stuff that makes you super drowsy. They work, but wow, they can knock you out. Then you have the newer second-generation options, like loratadine. They're just as good for the itching and sneezing, but they are way less likely to make you sleepy. And that's absolutely critical if you need to drive a car, go to work, or just, function during the day.
So, that brings up a really good question. If those antihistamine pills are so popular and we see them everywhere, why do doctors often recommend something else entirely as the first line of defense?
And here is your answer. And this comes straight from the clinical guidelines. For anyone dealing with moderate to severe symptoms, quote, intranasal corticosteroids, INCS, are the mainstay of therapy. So these nasal sprays, often just called INCS, they aren't just an option. They are considered the foundation of good allergy management.
And this chart right here, it perfectly shows you why. If your number one complaint is that awful, blocked up, congested feeling, well, the data couldn't be clearer. Oral antihistamines, yeah, they help a little. But look at the INCS sprays. Their effectiveness for congestion is on a completely different level. And that's because they're not just blocking histamine, they're tackling the inflammation right at the source, inside your nose.
Okay, let's just boil this all down into a quick guide. The whole key here is matching the right tool to the right job. So for all that itching and sneezing, a second-generation oral antihistamine is a fantastic choice. But to really defeat that stubborn, can't-breathe congestion, those INCS nasal sprays are hands down your most powerful weapon.
Of course, there are a few other specialized tools in the kit. You've got decongestant sprays, and these can be an absolute lifesaver for really bad congestion. But, and this is a huge but, you cannot use them for more than a few days. Maybe 3 to 7 max. Any longer and you risk something called rebound congestion, which can actually be even worse than what you started with. And for folks who also have asthma, there's a prescription pill called Montelukast that can be a great option because it helps treat both conditions at the same time.
All right, last section. Let's cover some really key tips for special cases and situations. These are some of the most common questions that pop up when people are trying to figure out treatment.
When we're talking about kids, safety and comfort are everything. You always want to go for the less sedating antihistamines so you don't mess with their school day. And if you're using a nasal spray, try to find one that's unscented and has a low volume. They're just going to tolerate it better. Now, for pregnant women, it might be surprising, but INCS nasal sprays are actually the go-to first-line therapy. And that's because so little of the medicine gets absorbed into the rest of the body, making them a really safe and effective choice.
I want you to remember this number, 6. Just 6. This is not just a random number. It is a critical safety warning from Health Canada. They are very clear. Do not use oral cold products that have decongestants in them for children under the age of 6. It's just not recommended. The reason? The risks of side effects just aren't worth the very limited benefits for little kids.
So, when is it time to maybe go beyond your family doctor and see an allergist? Well, here are a few signs. Maybe the standard treatments just aren't cutting it, or you're having bad side effects from the meds, or maybe your allergies are just seriously wrecking your quality of life. A specialist can really dig in, pinpoint your exact triggers, and talk to you about more advanced options, like allergy shots or immunotherapy.
So here we are. We've gone through diagnosis, the entire treatment toolkit, and all these key tips, which leaves us with the big question. With this full toolkit of options, what is the right allergy plan for you? Now you have the knowledge to have a really productive conversation with your doctor to build that personalized plan and to finally get your symptoms under control so you can get back to living your life.